How are you holding up, Brandon?
Doing all right. How are you?
All right.
Good. I wish it wasn't so cold, but yeah, here we are in Illinois.
Amazingly cold. Oh, I'm not fine. My church emailed me to sign when we meet, so I will sign on Friday if you need me to sign for you.
Oh, oh dear.
Yeah, I was. I had to do all night today, but I figured it out. Hi, Randy. Stephanie.
Hello. Hello.
Hello.
So it took me a second to get up and going because the last time I had to use my camera was for a Zoom happy hour that we had with my legal team at Beechridge Bishop. And I figured out how to make myself a cat for it. But
Are
I
you
had to have
like
like
cat?
Snapchat camera on my my computer, and then I couldn't figure. I couldn't understand where that everybody was coming from. I couldn't figure out how to turn it off. So
I love how excited you are by this.
Dr. Jurger must have been cold. He went and got a jacket.
It's so chilly out there.
It is.
Good morning. We'll wait just so everybody pops in. All right. 5:30, and we do have some announcements. I have just a reminder and get started page. So just as a reminder, once we kind of go over a couple of things, IT will cut us off before the recording. And as IT president, you are giving your consent to be recorded. It will be live streamed, and then we will also be posting it to our YouTube channel. So Evan, if you want to go ahead and tell us to pause and page before we officially start, I'll have a few quick housekeeping items. So Evan? We can't hear you if you're talking, Evan. Yes. All right. Thank you so much. And then I do have confirmation that our recording has started. So just as a reminder, by being present, you are giving consent to be recorded and that we are live streaming this and it will be posted online. Remember to mute your lines if you are not speaking. State your name before you speak. And of course, all votes should be conducted by a roll call vote. So Paige, if you want to go ahead and take it away, you are up.
Sure. This is Paige Toth. I'd like to call this meeting to order. Can I get a roll call, please?
Sandy, if you are talking, I think you're on mute. Sandy, can you hear me? Give us just 1 minute. Okay, we do have a backup plan. Sandy might be having some trouble. As you know from the email today, we are virtual today because our building's closed, but thankfully, since we have all of this great technology now, we're still able to hold our meeting and not have to go through rescheduling. So Bethany, as our backup, can you please do the roll call?
Yep, sorry, I'm pulling it up. I should have had it open. All right, Paige Toth,
Present.
Vivian Goodman,
Here.
Phil Tibbs,
Here.
Mary Jane Linton,
Present.
Candy Clevenger,
Present.
Jan Hack, Brett Jerger,
Here.
Sue Kraus, Dr. Meneganti, Janet Patterson, and Laura Zimmerman.
Here.
I did see, Bethany, that Jan, it looks like Jan is on the call, so I'm not sure if the microphone maybe isn't working, but it does appear that Jan is present. Just FYI. All right.
Okay, the agenda was emailed out in your packet. Can I get a motion? Are there any changes to the agenda, Brandy?
We would like to add under new business a review of our annual report, please. And that would be all.
With that addition, can I get a motion to approve the agenda?
Laura, so moved.
Mary Jane, second.
Okay, can I get a roll call vote, please?
Yep, Paige Toth,
Approve.
Vivian Goodman,
Approve.
Phil Tibbs,
Approve.
Mary Jane Linton,
Approved.
Candy Clevenger,
Approved.
Jan Hack,
Approve.
Brett Jerger,
Approved.
Sue Kraus, Dr. Meneganti, Janet Patterson, and Laura Zimmerman.
Approve.
Great. Brandy, any communication today?
No, we did not receive any public comment via email, and we did, per the guidance and direction from Mike Baggett with the state's attorney's office, we did update our website to show on our agenda that the meeting was going to be virtual, and then it was also put on the homepage of our website. So just so everybody knows, we still had it very accessible, and we have not received any public comment.
Perfect. Moving on, we have the presentation and acceptance of the financial reports.
I think, Paige, we missed the approval of
Yeah,
previous
approval of the meeting. I'm sorry.
That's all right.
Okay, so we have two sets of minutes to approve. They both were in your packet. The first one is the emergency meeting that was held on January 11th, 2021. Does anybody have any comments on that? Can we vote on these in a group or do we vote individually?
I think it's fine to vote on them in a group if
Okay.
there's no changes or amendments or anything.
Does anybody have any changes or amendments to either meeting? The last was our regularly scheduled meeting of January 19th.
No.
Can I get a motion to approve both sets of minutes?
So approve. Jan.
Motion
We
to
have
approve
second?
both.
Second.
Perfect. Thank you, Dr. Jerger. Roll call vote, please.
Paige Toth,
Approve.
Vivian Goodman,
Approve.
Phil Tibbs,
Approve.
Mary Jane Linton,
Approved.
Candy Clevenger,
Approved.
Jan Hack,
Approve.
Dr. Brett Jerger,
Approved.
Sue Kraus, Dr. Meneganti, Dr. Janet Patterson, Laura Zimmerman.
Approve.
Thank you. I'm just skipping all over the agenda. Went right to communication instead of public comment. So thank you for catching me on that. Brandy, do you have communication for us?
I just wanted to give a brief update on the COVID enforcement. I did let you all know what had happened with County Board, of course, and then that I was in follow-up communication with the state's attorney's office just to get some direction and clarification, as we have said that we would and have this entire time, to ensure that we are following what we are allowed to do when we are enforcing. I will say I have not been able to get that communication yet. So we are not doing anything. We're still following up on our complaint process and everything, but we are not taking any measures such as, suspending food permits or issuing cease and desist orders until I can get some information from them. We have still been following up on complaints and been working with any businesses reaching out to us with the changes in moving from one tier to another very quickly and then into the phases again. There haven't been as many, major complaints. And then also there are so many more allowances now that, it's not as stringent. So if and when we hear more, obviously we will continue to do our due diligence, but I just wanted to give you an update about that. In addition to that, I have sent some information out previously about our vaccination efforts. And I did want to make sure that you all knew we've made some, we had some struggles with the phone system and also the website, which the website is a third party vendor that unfortunately we cannot control what happens with that. But very proud and happy to say that we did, IT converted us from our phone system with the health department to a Teams calling system, and it has calling queue, it has voicemail, it has a certain hold time, it has the ability to have messaging. We've completely implemented a phone operators team to where that line is staffed during the hours of 9 to 3, Monday through Friday, but then they also staff in the evening to take care of any voicemails that came in that weren't handled as a live call during the day. And so that has been extremely successful, and people have loved it. And we've gotten a lot of really, really positive feedback, which has been really great. People have been very grateful to talk to someone. It also came in, definitely handy when we decided yesterday, before the building was going to be closed, we decided to move our second dose clinic that was scheduled for today. We moved it to Thursday. So we had several methods of communication that we could use to do that. But one of them was that we were able to basically get a team together very quickly and have them call everyone that was scheduled for today to tell them they were moved to Thursday and confirm that they knew that, so that no one was unnecessarily or unsafely getting out today in the weather. And then also we're doing the same thing for all of our appointments on Friday, which is over 500 appointments for second doses, and making those phone calls to people. One of the things that we did last week while we were testing out and kind of piloting the new phone operator system and getting everyone used to it and seeing what was working and what wasn't working, was we did phone in appointments only for all first doses last week. And we decided to not announce when we were going to have the clinics. So for example, instead of saying we're going to open this clinic at noon, you can start calling or get on the website. For that, we just informed the community, our staff, partners, et cetera, that we were just going to start posting them online and accepting these calls on all weekdays so that people could get signed up. And as we have, for weeks, we have phone in appointments only, and also 65-year-olds plus appointments only. So then that way they're not having to, for lack of a better word, compete with the online community to get a vaccination appointment. So last week we were able to do all phone appointments, and they were almost all 65 and older population. The people were thrilled to get an appointment. It was a really great way to pilot and also to help hit that target demographic that is at higher risk. So I think it was very successful. We've also been running vaccination clinics out at Richland now so that we have more of those indoors with the weather. And I think we really hit a really nice sweet spot on Thursday with the exact rotation of getting more people through there, but also making sure everyone's social distanced and all of that. And so that's been going really well. So very excited to give you all of that positive feedback. Obviously, we've had less cases. There has also been a significant decrease in testing statewide, about 20% less tests being run because people are just not coming to get tested. So that obviously impacts the numbers of positives that we're going to have. But I also think that due to the contact tracing and the strong team and process that we have, that hopefully that's working and that that's going well. So very excited to bring that information to you. Two other big changes last week. We were notified on Tuesday as a state that our allocation of vaccine for this week was going to be decreased significantly. On Tuesday, we did not have a number. They just said plan for a decrease. On Wednesday, they put out from the governor's office an announcement that phase 1B eligibility would be expanded as of the 25th of February. And so obviously the supply demand was already a major issue, and now it's going to be even more complicated. So that was a surprise to us because we had not heard that from the state yet. We found out with the press release. So we've been fielding calls about that and planning, and also talking with the vaccination subcommittee that consists of other healthcare providers and healthcare systems here in Macon County, so that we can all plan and make sure that we're on the same page. Another thing that we found out on, I think it was Thursday, I believe, or maybe Wednesday night, our allocation for what we're supposed to receive this week, which of course now is caught up because of the weather, but is 300 doses total for Macon County. To give you some idea for comparison, the previous couple of weeks, we got like a little over 1,400, and the 2 weeks before that we got 1,200. So we already have not been getting very much, and then they significantly decreased us to 300. And just as a reminder, what we get as the health department, that's our allocation for the community, and we can choose whether or not we want to share that with other partners. We have chosen to do that because we do have very strong partners here in Macon County who can help vaccinate, and obviously the health department can't do all of it on our own. So we've been very grateful that partners have helped out with that, and everybody's just been getting around a couple hundred doses, or some less if they don't need as much. But now with only getting 300 doses, it gets a lot more complicated to be able to get anybody vaccinated. Luckily, we do have Walgreens that's also vaccinating, and then Kroger is supposed to be starting, but we haven't gotten a date. I did call them just to see if they could tell me a date because the state hasn't yet. And they did say they expected probably this week to start doing the public. I know there's another private pharmacy here, Dale Southlake, that they are trying to get approved to be an eye care provider, and I hope that that happens. The pharmacy's allocation is separate from ours at the health department, and we are not told how much they get. So all I can hope is that they're getting a lot more, so that more people in our community can be vaccinated more quickly, but that's outside of our control. And again, we don't get told that information. So hopefully we'll get more vaccine in the near future, but they have said the next 3, including this week, the next 3 weeks were going to be much smaller allocations because they needed to make sure everyone was getting enough second doses throughout the state. And so our projected amount for next week as a county is 300, and the projected amount the week after that is 600. And this is doses, not vials. They did say the next 2 weeks allocations are not guaranteed, so there's a chance that could go down. Hopefully it won't. But just to kind of give you an idea, if you're hearing from the community or anything like that of what we're looking at, phase 1B, we don't know exactly how many people are in that, but we've been doing some quick math. And even if we only talked about the 65 plus population in Macon County, so that doesn't include anyone else in 1B, and it doesn't include the expansion of 1B, we are looking at about 23,000 plus residents. And at the rate of getting 1,200 doses a week, we figure that would take almost 18 weeks with just that population alone. So if that kind of gives you an idea of when we say as the health department it's going to take months to get through phase 1B, we are not over exaggerating, because there's a lot of people in that phase of eligibility. And now if they're expanding it, it's going to get significantly bigger, because it does include now anyone that would be having any type of comorbidities or certain types of conditions. So it will greatly expand that. And again, that's not effective until February 25th. The press release that did go out in one spot said we're moving, and in another spot said if the county's ready or close to ready. So we haven't received any kind of formal direction on that, but we have been, again, communicating with our partners to ensure, at least as Macon County, we will all be on the same page in how we are moving forward. I did hear today that the pharmacies locally are already moving into that expansion. So that could cause confusion depending on what we decide as a vaccination subcommittee and as a health department. And also pharmacies do not have to adhere to the live or work in Macon County requirement like we do with our allocation. So if you hear anything that's confusing, some of these are the reasons why. I'm sure that I'm forgetting something because there's so much that happens every day and night here. But if any of you have any questions whatsoever, you know that you can reach out to me anytime. But if you have any right now, the floor is definitely open and I'm happy to answer any questions that you have that are more specific than what I've said.
Does anybody have any questions for Brandy? Brandy, this is a big task and you guys are doing a great job. I know how tough it is working in the healthcare industry as well. It's quite a challenge in getting it from all sides. So, and 300 doses is crazy low.
Yeah, I think I will say that I don't know if I've mentioned this to all of you before. The state has said in the past, not to really put out a lot of information about doses, but to give more information about how many appointments you have available. But I think with the doses being so low this week, and I have talked to other administrators in other counties, and they've taken a similar stance, that the community needs to know just how low the amount of doses are. Because as you've probably seen, and I don't know how much detail I've given you on Board of Health meetings, but yes, we are definitely getting beat up badly about people not getting vaccinated enough or first or anything. Our vaccine, when we get it, it's almost immediately out, and we're almost zeroing ourselves out every single week. And we're encouraging our partners to do the same because the state has threatened that if you let your vaccine sit on your shelves too long, they're going to decrease your allocation. So it takes a lot of careful planning and logistics to make sure that you're using all of it. We also don't know what we're getting until the week before. And then we don't know exactly what day we're going to get it. They've given us predictions every week, but it's not always solid as far as when it actually shows up. So it's very difficult to schedule very many appointments far out at all for anyone, because if that vaccine comes, you can imagine how more upset and even confused some of our population is going to get if then we have to call and say, actually, you're canceled, and we don't know when we can get you in because we don't know when we'll have enough vaccine or what day it's going to show up. So when we do hold clinics and it looks like last minute, or we do open up appointments and it appears to be last minute, it's because we're moving as fast as we can. And when we get the information, we already kind of have tentative dates in our minds of when we're holding clinics and how many staff we need and all of that. But if we don't know what our allocation is, then we aren't going to promise appointments. That's caused, problems in other areas, and that's not something that we are doing. And the state, now that they've dropped our allocation and every county's allocation, it's not just Macon County, but when they've dropped that allocation so much, it does show like, well, it's a good thing that we didn't schedule anybody too far out, because we would have a lot of really disappointed and upset people. So I think it's getting harder and harder for staff. And like you mentioned, Paige, it's not just at the health department, but in healthcare right now. I think to keep going on some days, because there's a lot of positive, but there's a lot of people who have a lot of negative or very hateful things to say. And of course, that's on social media. It's on phone calls or voicemails or whatever it might end up being. So I think that the team at the health department is doing a great job. I've said a lot of times, none of us is perfect, especially in a pandemic. I think my team, they're doing their very best, and I support them for that. And I'm grateful to them for that. But it is hard, and I'm trying to find more support for our staff so that they can have the mental health support and the emotional support that they need, because when they're working the hours that they're working and then some of the treatment is happening like it is, that makes it tough. And we and other health departments have lost staff because of the way people are treated, and they just can't take it anymore after working a pandemic longer than a year. So I hope that doesn't happen, and we're really looking for more ways to support them and take care of them, because like I tell them, they deserve to make it through the pandemic healthy and safe too. So yeah, Paige, I appreciate that. And I appreciate any of the positive feedback and support we get, because our staff definitely need it, especially on those harder days.
Great. Are there any other questions for Brandy? Okay, now I think we're ready for the presentation and acceptance of the financial report.
Okay. And And I do have an update for you. If you recall, last month we were in the transition process between two different softwares. We are still in that process, so we still aren't able to provide the type of financial report for this meeting that you all need and want. So the accounting software is being used, the new software is being used for payment, et cetera, but then payroll was still running the old software. So they're in the process of getting now everything into the new software. We also are converting to a new time clock that is a part of the new software, just so you all know that. And so Cherie is going to send that out, or have Sandy probably send it out to you via email when it is ready, when that whole conversion is finished. But then we will do a formal approval of that at the next meeting. But then that way you have it as soon as possible, but we'll do that formal approval at the meeting.
I should probably get off mute. Thank you. Thank you for the update. Okay, the department expenditures were in your packet. Does anybody have any questions on those? If not, I would entertain a motion to approve.
Phil, move to approve.
Can I get a second,
Brett,
please?
second.
Great, thank you. Roll call vote, please.
Paige Toth,
Approve?
Vivian Goodman,
Approve.
Bill Tibbs,
Approve.
Mary Jane Linton,
Approved.
Candy Clevenger,
Approved.
Jan Hack,
Approved.
Dr. Brett Jerger,
Approved.
Sue Kraus, Dr. Meneganti, Dr. Janet Patterson,
Approve.
Laura Zimmerman.
Approve.
Thank you. Brandy, do we have any grant applications for review?
We do not know.
Thank you. Brandy, do we have any? Okay.
Paige, I'm sorry. I didn't mean to interrupt you. I just want to make sure to kind of give a little more information on that. We will have one for next month. We did find out we're going to get some funding for our mass vaccination. It is not very much, and as we're working the budget, and now we do have it turned in now. It's not approved or anything yet from the state, but it is possibly going to be in the amount of $275,000 if they approve our budget and all, which is pretty much going to be used up by just nursing staff. So we are obviously concerned about all the other expenses that come with mass vaccination. So hopefully more funding will come through, but we will have that for you for next month, just as like a formal approval of it.
Thank you. Okay, your department division reports were in your packet as well. I hope everybody had a chance to review those. There's a lot of other great work going on at the health department outside of COVID. So thank everybody for their work there. Does anybody have anything to add or any questions? I think there was there a supplemental one sent out today, or that was the annual report? That was last month.
Yeah, that was the annual report.
Yep. Okay, moving on to employee recognition. We have Cheryl Raffini with 35 years. That's amazing. Thank you. Mariah Kohler with 3 years, Jamie Smith with 3 years, and Cassie Byers with 1 year. Thank you for your service. Old business.
All right. I think sorry, I'm flipping back and forth between a couple of different things. Hold on. So that I think is just the COVID enforcement update, which I accidentally gave in the communication. So I apologize. So there's nothing else for me to add there.
Okay, great. New business. It looks like first we have the approval of an updated bereavement leave policy.
Yes. So if you want to refer to your packet, this looks like on page 13. So all we did on that first one, number 1, and it does have a brief explanation for you of what was changed, and then that we mirrored our sick leave policy. We just basically realized that we did not have domestic partner included in the bereavement leave policy like we did in our sick leave policy. So that was just added in there to ensure consistency and inclusion with that. So if nobody has any kind of questions or anything, that was a very, very simple change with that one.
And you want us to vote on that one? Yes.
Yeah. Yes, if we can, or if you want me to combine it with the other policy, I think that's fine, whichever you prefer.
I think let's go ahead and go through all of them, and if anybody has any concerns, we can separate, but let's try and get them all in one.
Okay, so the second one is just a change to our flex time policy, which most of you, if you've been on the board for a while, are aware of. This again was just a small change. Instead of it accruing by the day, it's going to accrue by the week. So the long or the short story of it is that someone will still earn the same amount of flex time if they are eligible and approved. But because of the adoption of this new time clock, it's going to accrue by the week instead of on each specific day. So nothing is changing with their time. It's just the accrual of the time so that our policy reflects how the time clock is going to work. And we have not yet fully implemented the time clock. We have a group piloting it, but wanted to get this policy approved before we did do a full implementation of it.
Okay, thank you. Does anybody have any questions on those two policies? I would entertain a motion to approve those two policies.
Mary Jane, I make a motion, we approve.
Laura, second.
Great. Can I get a roll call vote, please?
Paige Toth,
Approve?
Vivian Goodman,
Approve.
Phil Tibbs,
Approve.
Mary Jane Linton,
Approve.
Candy Clevenger,
Approved.
Jan Hack,
Approved.
Dr. Brett Jerger,
Approved.
Sue Kraus, Dr. Meneganti, Dr. Janet Patterson,
Approve.
Laura Zimmerman.
Approve.
Thank you. And it looks
Approved.
like next up we have a resolution authorizing donation or disposal of surplus property.
Yeah, so this is pretty simple. It's just a process that we have to go through with the county board to get approval. We have some refrigerators that we have been able to replace. We got approval in our contact tracing grant to purchase new ones so that we would have, you know, what we need and as many of what we need in order to store vaccine. And so we did receive those. They took a little while to get to us, but we did receive those. And now we just need to dispose of the refrigerators and a little freezer that we do not need. We do have to go through a process of checking with other county departments first, which we have not done yet because this is just happening. They just, I think, came last week or so, but they're just kind of sitting to the side right now. We want to get them out of the building as soon as possible because we just don't have room for them with everything else that's going on. So if other county departments want them, that is an allowable way to dispose of them. If no county departments want them and you all and then the county board approve this resolution, we will be choosing to recycle those. So basically we just have to get approval from you and then the county board to get rid of them.
Are there any questions or would somebody like to make a motion to approve this resolution?
Laura, make a motion to approve.
Mary
Phil,
Jane.
second.
Second. Well, Phil, second.
Okay, thank you. Can we get a roll call vote, please?
Paige Toth,
Approve.
Vivian Goodman,
Approve.
Phil Tibbs,
Approved.
Mary Jane Linton,
Approve.
Candy Clevenger,
Approved.
Jan Hack,
Approved.
Dr. Brett Jerger, might not be on anymore. Sue Kraus, Dr. Meneganti, Dr. Janet Patterson,
Approve.
Laura Zimmerman.
Approve.
Approved.
Okay, thank you. Brandy, I did not write down the other agenda item. Was there something other new business that we were discussing?
Just the review of the annual report.
Oh, that's right. That's right. Thank you.
So that was
And
sent
this
to-
was mailed out separately.
It was. Sorry, I didn't mean to cut you off again. It's hard on Teams sometimes to know if somebody's done or not. Yes, it was emailed out today. It was emailed last week, but then there were some changes to county board members. And so they did update that. That just happened Thursday night. So they updated it and got it sent out to you today. That's just our annual report that we put out each year. And so we wanted you to see it, see if anyone has any questions. Marissa and her team, the Health Promotions and Public Relations team, did it with the help of the other supervisors in the building. And so if you have any questions specific to any of that, we can definitely answer those at this time.
And I do want to say that I feel like for the first time, the annual report, when you look at it, you know, while the numbers are great and it's good to see what we've done throughout a year, I feel like for the first time, the annual report doesn't really show what happened in 2020. We did report the total number of cases, but our other services were obviously impacted by that. And so I just want to say that I'm proud of my team and my coworkers, just exceptionally proud of the work that they did over the course of 2020. And, numbers might be down in certain areas, but that was a crazy year, and we have an incredible team.
Thank you, Marissa. Does anyone have any questions or anything about the annual report? All right, and we will get that published by the due date. We're actually ahead, which is awesome, especially in COVID. And if any of you think of any questions you have or anything, please just let us know. And I think that's it. And Paige, we have one thing to review and close if you wanted to get a motion to move into closed.
Sure. Thank you all for your work on the annual report. It looks great. Can I get a motion to move into closed session, please?
So moved. Jan.
Sandy second.
Okay. Sorry, I didn't know. Did we get a second? Yeah. Roll call vote, please.
Paige Toth,
Yep.
Vivian Goodman,
Yes.
Bill Tibbs,
Yes.
Mary Jane Linton. Vivian Goodman. Bill Tibbs. Mary Jane.
I was muted. I'm so sorry. I was saying yes, yes, yes.
Thank you. Candy Clevenger,
Yes.
Jan Hack,
Yes.
Dr. Brett Jerger,
Yes.
Sue Kraus,
Yes.
Dr. Meneganti, Dr. Janet Patterson,
Yes.
and Laura Zimmerman.
Yes.
All right, we'll move into closed session at 6:04. And anyone on the call that is not a board member, or Bethany or Sandy, please now remove yourself from the call. Board members, stay on.
Thank you.
Bye,
Have a good
everyone.
evening.
Thank you.
Thank you all for being on. Board members, I am going to stop the recording. Go ahead, Evan. Yeah. Yes, but I'm doing a backup just in case. So we're good. All right.
Evan, I see you. So whenever you're ready to count us off, I am recording, so we're good to go. Thank you.
Okay, we're back from closed session. Can we please get a roll call?
Paige Toth,
Present?
Vivian Goodman,
Present.
Phil Tibbs,
Present.
Mary Jane Litton,
Present.
Candy Clevenger,
Present.
Jan Hack,
Present.
Dr. Brett Jerger,
Present.
Sue Kraus,
Present.
Dr. Meneganti, Dr. Janet Patterson,
Present.
Laura Zimmerman.
Here.
Okay, following closed session where we reviewed previous closed session meeting minutes, I would entertain a motion to keep the minutes reviewed closed.
Vivian motion.
Jan second.
Roll call, please.
Paige Toth,
Approved?
Vivian Goodman,
Approved.
Phil Tibbs,
Approved.
Mary Jane Litton,
Approved.
Candy Clevenger,
Approved.
Jan Hack,
Approved.
Dr. Brett Jerger,
Approved.
Sue Kraus,
Approved.
Dr. Meneganti, Dr. Janet Patterson,
Approved.
Laura Zimmerman.
Approve.
Great, thank you. Now can I get a motion to adjourn the meeting? I think that's it, right, Brandy? Nobody wants to
So
leave.
moved. So moved.
Second.
Mary Jane.
And one more roll call for vote, please.
Perfect. Paige Toth,
Approve.
Vivian Goodman,
Yes.
Phil Tibbs,
Yes.
Mary Jane Litton,
Yes.
Candy Clevenger,
I'm sorry,
Jan
yes.
Hack. Oh, sorry. Okay, I didn't know if you're still on there. Sorry. Jan Hack,
Yes.
Dr. Brett Jerger,
Yes.
Sue Kraus,
Yes.
Dr. Meneganti, Dr. Janet Patterson,
Yes.
Laura Zimmerman.
Yes.
Great, thank you, everybody, and thank you, Brandy. That was actually a pretty quick meeting considering all the roll calls.
I know.
Good job, Bethany, on the backup.
I was trying.
All
Thank
right.
you all so much for